Thank you for joining us for our next session, The First Year, Thriving After Your Initial Diagnosis. I'd like to thank our sponsor, AstraZeneca, for making this session possible. If you've recently been diagnosed with ovarian cancer, it's normal to have lots of questions about the future. And this session will cover the basics of how to navigate your disease as you move from treatment into survivorship. Our speaker for this session is Dr. Randalynn Vasel. Dr. Vasel is a gynecologic oncologist and an associate professor of obstetrics and gynecology at Washington University in St. Louis. You can view her full bio on the conference website. Thank you for being here, Dr. Vasel, and I'll turn it over to you.
Thank you for this opportunity to present and talk to you all about the first year, thriving after your initial diagnosis. So what happens the first year after diagnosis? For some with early stage cancers, there'll be mostly surveillance. For some who are diagnosed at more advanced stages, it'll be more of treatment and recovery from active treatment. And so these are some tips, and hopefully we can go through some ideas of how to thrive during this time. So basics in thriving, whether undergoing surveillance or treatment. One of the first pieces is to battle fear and anxiety head on. What does that mean exactly? Well, we all have fears in many different ways. And so one idea is to actually list the fears, make a list. And that way you can really almost visualize and be able to see, what this list can be, and then actually provide some solutions and ways to, thrive with these list of fears. And let go of the past. What does the past mean? So the past could either mean, what life was like before the diagnosis, or it can mean the past in terms of what it was like during surgery, or what your first cycle of treatment was like. And sometimes, the past can have negative feelings, and really sort of letting go of that and focusing on the day of what you are now and where you are now, and what we can do in the future. And accept there's going to be bad days, just like before the diagnosis. There are days that were bad and some that are really good. During this time, especially during treatment, there might feel like there's more bad days than good days. And so I'll provide some tips on how to thrive during these times and lean on your support system. So I have some of my patients who will tell me, doc, I just want to be by myself. I don't want to talk to other people. I don't want to share. I don't want to hear what they have to say. I just want to be by myself. And that's totally perfectly fine as well. And I do find that with those one who really look to themselves for strength, that there might be one or two people that they lean on, and that's totally fine. But there's some that actually get energy from supporting and getting support from those around them, like a really large group, or even social media, even people they have never met before. So really finding and what your support system works for you, and leaning on them during this time is really important. So thriving while on treatment, advice from Randalynn Vasel. So Randalynn is a very special patient of ours from St. Louis, one of my colleagues' patients, and she was diagnosed at a very early stage and early age, so 36, but she was diagnosed at an early stage where she still needed treatment. And so Randalynn had, two small children, and has really been a voice in our city and our community in terms of how to thrive during treatment, because not every day for her was a good day. And so I actually asked her and leaned on her to give us, some advice, and really build upon that as a way to see how someone who, before her diagnosis had everything kind of moving in a good direction. And then this really, sort of halted what she was thinking, what would be, life for her. So Randalynn said, when she was going through treatment, especially chemotherapy, she had the carboplatin and paclitaxel, and, she just did not know how she was going to handle it. She was a single mom and, just didn't know. So one thing that she always talks about is to share with others that all you have to do is to show up and let your treatment team do the rest. She says, that sounds really pretty straightforward. All you have to do is show up. Of course, that's, common sense. But sometimes that's the hardest thing to do, actually, is really getting that effort and actually feeling like you want to show up. So in her mind, she would tell herself, and she's noticed her friends and colleagues she shared this with, that they remember this, in their voices and in their heads as they're trying to get to treatment. All you have to do is show up. And so one foot in front of the other. The timeline ahead of you is more than you can ever think of. We're talking about surgery, talking about treatment, talking about appointment, talking about CT scans afterwards. Just thinking about on one hand, it's really important to know what to expect in the long term and what is the sequence of events of what you expect for your treatment plan. But sometimes it just helps to break it down, just think one foot in front of the other. Let me just focus on, what's next. I know what's next, maybe months from now, but really just focusing on the immediate, the next foot instead of steps ahead. And you don't need to tackle all of the treatments and issues at one time. And, I know there's probably others have told you that, take it day by day, take it one step at a time. And sometimes you think, well, but, how am I going to do that? So we'll talk about ways to make this happen. So movement when you can. Randalynn says that, for her, she was a very active person before her diagnosis, before treatment. And she found that, setting actually small goals during her treatment was interestingly sometimes, difficult to obtain. For example, there were some times when making it out of the bed to the kitchen was a goal. And, in the past, that was something that was obvious. You didn't have to think about it. But there are days during treatment where this was a goal for her, and this actually helped her to set this small goal about moving, movement even as to the kitchen. And then the next day was leave the house to the mailbox. Again, pretty obvious, something that seems really simple and straightforward. But for her, it actually really did help to think about that and think about movement in that way. So, sometimes your doctor might say, oh, have physical activity, make sure you do that. You think to yourself, there's no way I'm going to be able to do that. And so instead, reframe it and think about, making those small movements that really will make a difference. And yoga, meditation to her were very game changing. The idea that your mind has to be strong in order to really, work along with your body. And now is the time to put yourself first. Randalynn uses the word sometimes, be selfish. It's okay to think about yourself. How many times have we not thought about ourselves? So, take the time that you need to process what's happening or has happened. For some of my patients, when they look into themselves or inner strength, it's because they're putting themselves first. There's certainly, a neighbor or a friend or family member that really want to help you. And so you think to yourself, well, okay, fine, I'll let you help me because you're my support system. But truly, all she wants to do is take that time to reflect and put herself first. And that's okay. There's certainly the timeline for that. And so based on that, also reflecting on your own, talking through with another survivor or counselor sometimes can be helpful because they know what it's like what you're going through. And that sometimes is really important to also work on that too. So other tips, how to thrive on treatment, eating well during treatment. We all know, try to eat well. Yes. Well, what does that mean? We'll go through some of the tangibles, what that actually means. But in general, the idea is a healthy diet can help your body function at its best, especially during treatment. Ideas like Greek yogurt, creamy peanut butter, eggs, bananas, cottage cheese, rice, these are all probably foods that you've heard of before, but really trying to put it down here in a sort of a snapshot of, what are some really quick, easy ways to eat well during treatment. And everyone's going to have their own foods that actually they like and prefer more. Taste buds do change during treatment. So some will say, gosh, water doesn't taste the same anymore. It tastes so metallic-y. And so I'll give you some tips later on how to thrive actually during the times when you need to actually stay hydrated. What are some, ways to do that? And in terms of, these types of foods, there's certain ones that you actually will like better than others. And so, but trying all of them is fine. There's some foods that you actually might have really not liked before the diagnosis and before treatment. And because taste buds change and because your body changes, you might want to try it again. Some say, oh, cottage cheese, I never wanted to try it. But someone actually told me that actually during their treatment, that's actually what they really liked, even though they never liked it before. So don't be afraid to try new foods as well. So in terms of, what to limit, one may say, salt, cured, smoked, pickled foods. But if that's actually what you crave, then that's okay to try that. It's just sort of these ideas of, in general, what to limit. But again, like sometimes, listening to your body during treatment, and everyone's different as well. But these are just small tips, avoiding red or processed meats. But, if you're craving something that's red or processed meats, then go for it, especially during treatment. The idea of diet changes, you need some extra fluids, proteins, calories needed. Sometimes you just need to actually snack because eating a whole meal just sounds too much for you. And that's okay. And sometimes snacking for, the first day of treatment or second day of treatment is probably all that you can do. And actually, if you snack enough, you can meet your goals for for dietary reasons in terms of, focus on protein-rich foods like yogurt, cheese, and crackers. And then remembering the healthy fats. So olive oil, nut butter, and avocado. These are sort of tips that I have mentioned to my patients that they, drizzle on that olive oil. Use avocado whatever way you want to make it. That really does help increase those calories and the healthy fats that will help provide energy during the treatment time. And what are some other tips to get more calories and proteins, eating your favorite foods at any time of the day? So if you love breakfast, you can eat it for dinner, no problem with that. So, think about ways to be creative in terms of your foods. Eat every few hours. Don't wait until you feel hungry. Sometimes that, doesn't make sense all the time. So, every day might be a little bit different during treatment. So there might be days that you notice that when you're not hungry, you eat, you actually feel better versus, getting to the point where you're super hungry and then you're eating and it's just too late for you. Eat your biggest meal when you feel the hungriest. Try to eat high calorie, high protein foods at each meal and snack. And sometimes you might exercise or take a walk before meals. It actually builds up some of the hunger. Drink high calorie, high protein beverages like milkshakes. And drink most of your fluids in between meals, because if you drink it during your meals, you actually might fill up with the fluids versus the food themselves. And what about milk products? Well, these are high protein foods. So if you are someone that isn't lactose intolerant, then try to just, instead of eating toast, eat some cheese. Have some cheese with your toast or with crackers. Add grated cheese to baked potatoes and vegetables and soups. Add Greek yogurt, cottage cheese to your meals. So just really adding these high protein foods to your diet. Eggs are a great source of protein and energy. Meats, poultry, and fish. I tend to talk about having chicken thighs many times because it's a dark meat, but it's not red meat. And so chicken thighs provide a good source of red blood cells. So for those that might be more anemic, that you get, having low red blood cells during your treatment, having chicken thighs in whatever form you want to do, barbecue, in the stews with tomatoes or something of that sort, or just your chicken noodle soups that you have, cook your chicken really softly. So the chicken thighs is a good source of nutrition for that. Beans, legumes, nuts, and seeds. So spread peanut and almond butter on toast or blend in a milkshake with some almond milk. If you're having some diarrhea from treatment, an idea is maybe smoothies with bananas, peanut butter, and almond milk. The idea is just, thriving while on treatment can actually mean incorporating foods that actually make you feel good during this time too. So a couple of ideas is, some women will say to me, I like your suggestions, but I'm just feeling really gassy and bloated. Like, what foods should I actually focus on? And so during treatment, based on where maybe the tumors have been or are, based on maybe what happened during the surgery, you might have these symptoms. And what are some foods to focus on? So one idea is to first, regardless of what type of food, just small, frequent meals to avoid large portions. So you might find yourself eating every 2 hours, and that's okay to do that. If you're lactose intolerant, avoid high lactose foods. I know that's common sense, but sometimes you might be craving, lactose foods. But if you're lactose intolerant, then it's best to stay away from that, especially with gas and bloating. Avoid straws, carbonated drinks, because that, avoid chewing with your mouth open, because that does increase swallowing air more, which then leads to gas and bloating. Avoiding fatty and greasy meals, because those do cause slow digestion and can contribute to bloating. And then gas forming veggies. So broccoli, cauliflower, Brussels sprouts, cabbage, bok choy. These are all veggies that you might be craving, but they're just well known to cause gas and bloating. And if you eat a vegetable that's not on this list and you notice gas and bloating, certainly look it up and make sure and see if it does lead to gas and bloating usually. And if it does, it's best to stay away. So one idea that's all you really want are these types of vegetables. So if you cook them very thoroughly, that actually does take away some of the gas and bloating properties of these vegetables. So one concept is always stay hydrated. Many times during infusion, we're giving you IV fluids beforehand as well, but we always tell our women to have a water bottle or something next to you during your infusion time. I know it's sometimes a pain to get up, and go to the bathroom, but staying hydrated before, during, and after treatment is really important. So, treatment can change the taste of water. So sometimes you might, instead of having the ice cold water, you might want warm water with lemon or honey. Maybe sparkling water, especially if you're not having gas or bloating symptoms at baseline, can be a way to stay hydrated. Try tea sometimes. Decaffeinated is probably better because the caffeine can cause you to actually become dehydrated internally. So, staying hydrated with teas, especially decaffeinated. And fruit infused water, maybe add some watermelon, oranges, or strawberries to your water to help with that flavoring as well. And for some of my women, they've had to try like a whole range of different types of, waters with, carbonation, and some they've noticed sparkling waters have different bubbles than others. And so it's just sometimes, um, difficult to find which one works for you, but it definitely can find something to stay hydrated. So physical activity, we've all heard about how physical activity has many benefits, can help maintain muscle mass and bone strength. And during treatment, actually help with, reducing depression, stress, fatigue, nausea, and constipation, and can also improve appetite. So one idea is to aim for 30 minutes of exercise, like walking every day, and listen to your body and rest when you need it. So 30 minutes a day sounds like a lot, especially if you're maybe your second day after treatment when you're just feeling, fatigued, which is a very common side effect of treatment. So what do you do to actually make these 30 minutes? So what I do sometimes is, talk about keeping a log. So it doesn't have to be 30 minutes at one time. It is helpful, to get to a point where you can, feel your heart sort of beating fast. And that's a good way to know that you're actually, kind of having some exercise that's leading your body to actually work for it. But, what I said earlier on, sometimes just, setting those movement goals, getting up to go to the kitchen, getting up to go to the mailbox, sort of forcing yourself to go outside just for a little bit, even though you don't want to. That counts, count that as part of your 30 minutes, because part of this too is to know that, you're meeting these goals, and that does help the overall. And every day, you might set a goal where you're going to the mailbox twice versus just one time. So just really focus on this, because there are long-term benefits from it in terms of the mind-body connection. Energy level. So getting tired is more common while on treatment. So, how do you thrive then while on treatment with your energy level? Well, some of it also is just expectations. So knowing that one day that has really good energy level can be followed by a couple of tired days. And there may be this pattern that follows. I have many of my women that will tell me, I know, by after the first 2 cycles, I know what the pattern is. So I know that when I have my treatment on day 1, day 2, day 1, 2, and 3, I'm just tired. Or they might say, actually, I feel pretty good because I've had some steroids and I'm feeling a lot of energy. It's day 4, 5, and 6 that I feel really tired, but that's okay because I know that's the pattern. And then my energy level, I know will get back up. And so I really plan around that these feelings and these energy levels. And for those really on the go before before their diagnosis, it's this idea of it's okay to give in and rest. Randalynn actually mentioned that for her, she would push herself through these feelings of feeling tired and fatigued, and actually caused her to be more frustrated because her body just literally was tired from the treatment. And it's sort of how the body responds to treatment, and that's really okay. So as long as you stay hydrated, because sometimes when you're feeling fatigued and the energy level, it is a sign of dehydration. So as much as you can, I always sort of have a tip to drink some water or something. We try to stay away from sodas and sugary drinks. So anything with more of a water based, and then drink before you start to rest, or make sure you have some water next to you, because that way you're making sure that your energy level and feeling low is not due to dehydration. And that really does help as well. So what are some dietary adjustments for constipation? So constipation is common with chemotherapy such as paclitaxel. So drinking fluid, drinking this water, 80 ounces every day does help with constipation in general. And so that's a pretty key ways to adjust for this. Staying active, low intensity exercise, that 20 to 30 minute walk if possible, that actually improves digestive motility. And incorporating high fiber foods like fruits, vegetables, whole grains, and beans. And then incorporating stool softener and laxative can also help, sort of this feeling of thriving during your treatment, adjusting for constipation. So what about diarrhea? Interestingly, diarrhea can also be seen with paclitaxel. So I have some women that say, I know with chemotherapy, I'm constipated on X, Y, and Z day, and then I have diarrhea on these other days, and who knows why, but this is what happens, and they sort of adjust for it based on that. So in terms of diarrhea, there are ways to get through it. So drinking caffeine-free, low-sugar fluids throughout the day will help with that. Drinking at least 1 cup of fluid for every loose bowel movement, and avoiding sugary drinks, which we mentioned already, because this can make the diarrhea worse. And limit insoluble fibers. What that means are, limit your skins and peels of produce, and then increase your soluble fiber. So rice, bananas, oatmeal, potatoes without skin, and applesauce. So kind of like that brat diet that we talk about sometimes, bananas, rice, applesauce. And avoid fatty, greasy foods. This does also lead to diarrhea. So it doesn't mean stay away from healthy oils like olive oil and avocado. But during the diarrhea, sometimes, bananas actually really do help bulk up, and also does constipate. So if you are feeling constipated, remember to maybe stay away from the bananas. So what are dietary adjustments for any of those who are at risk for bowel obstruction? So what is a bowel obstruction? This is a blockage in the intestine that prevents foods and fluids from passing. And for those of you who have not heard about bowel obstruction, don't have to be worried about it, but I just wanted to address this just in case this was a concern. So for those who are at risk for bowel obstruction, some foods you can consider include Greek yogurt. So it's a good form of protein. It's really pretty easy to digest. Foods to avoid if you are at risk include fresh or dried fruit and skins, canned pineapple or fruit cocktail, raw vegetables, stewed tomatoes, potato skins, cabbage beans, kind of gas forming foods, and coarse whole grains or grains with seeds or whole spices. Popcorn is also important to avoid, and meat with caseins and chunky peanut butter. If you don't have a history of bowel obstruction, again, you don't have to worry about avoiding these foods at all. But this is for those who are at risk. And if you're not sure you're at risk, I would, your provider would have told you. So I just sort of, just some tips in case you have been informed about this. But again, if you haven't, don't worry about this at all. So in terms of, sort of last bits of thriving after treatment. So Randalynn says, give yourself grace. It will take time to get back on your feet. And I think, for Randalynn, this was really important because she was, so used to, moving, and she still is. I mean, now, gosh, if she's just so active, but it really was important to her to remember this and to now really spread the word for others. Give yourself grace. It will take time to get back on your feet, but you will get back on your feet. And the body might not work the same way. You might feel exhausted, all the time. And that might be common, for some days, not all the days, but just realizing this is kind of giving yourself grace again, that feeling exhausted might be more often than what you had felt before. And relearning will be common, and you'll still be able to do what you've done in the past. It just takes time to relearn how to do that, and take time to rest and to try and to adjust. And this is a nice picture of Randalynn when she was getting her 6th cycle with her family and her support group, and this was her right before her end of her treatment. So she also wanted to share other words, and she, which I thought was really important, having a really great relationship with your medical team. She's really close to her GYN oncologist, and also really close to all of us too. We have, worked together with, advocacy groups in town as well as nationally. And, but, she wasn't afraid to ask her doctor about all the questions. So there, certain questions she thought, gosh, it's just in my mind. I'm having some pain, maybe it's really nothing. Or she, was worried about her lymphedema, but didn't want to bother her provider and figure that she can figure out herself. But then she realized there's solutions she didn't even think about and she didn't realize, so, for her lymphedema, we talked to her about compression stockings, go to occupational therapy. There's a flexi-touch system. So she was really happy that she did actually reach out and ask her doctor, even, after treatment, there will still be questions. And also, one way to thrive during this time is to just acknowledge that it's okay that there are days that might not be okay. Meaning that, it's sort of, I always talk about what life was like before the diagnosis. There are also certain days that, you might not have felt okay. And the same will be true during this time. And so no one is expecting you to do this alone. This goes back to having a support group if that's what really helps give you the energy and the way to thrive. And for those who really want the inner strength, that's okay too. But just realize that if you do need to reach out certain times, that's okay. And, and setting, limits or expectations to your friends and family that you do want support, by putting yourself first, you can say to them, hey, look, you know me, I'm a private person. I don't usually need much help, but just for this one day, do you mind coming over and just sitting with me and reading a book? And they might, they'll probably be more than excited and happy. And you already set the limits that like, hey, just for this one day, can you come and do this with me? And I think that's a way to think about it. And they, I'm sure, will be respectful of that time. And after they spend time with you that one day, you can just say, thanks for doing that. And, I'm sure I'll need, I'm sure I'll need you another day, and I'll be sure to reach out to you then. So that way, you're putting it on the idea that you will reach out to them, but certainly you might want them to reach out to you, and you can make that known too. So the whole idea is that, thriving after treatment, it's about you, about what you need. And so just really think about it that way. So fitness reboot. For those who were, really active and, working on fitness before, fitness may be completely different. You might need to modify the workouts. Running seems to be maybe a little bit more difficult after treatment. There'd be pain in the knees that are common. So sometimes spinning or swimming might be a better option. So just thinking about that, I mean, certainly try what worked for you in the past, but if you notice that's a little bit different, got to reboot your fitness regimen and just, trying something different. And usually the spinning or cycling, riding tends to be a little bit easier. And this actually comes with just age. I mean, just in general, for those like, there's certainly runners who are, older on the older spectrum, but in general, cycling, riding is something that tends to appeal to, for everyone who ages. So it's not just maybe, for those after treatment, but just kind of a way of life. And so here is a nice image of the OCRA group and the cycling events throughout town. I just, find this a really invigorating way to think about community coming together, all different parts of the cities and towns in the United States to work together towards this. So how to maximize your memory. So people call it chemo brain, or, just sort of, I'm not thinking the same way anymore. And that might be true. Memory may be different after treatment or even after diagnosis, but some actually say memory is different even after menopause. So what all this kind of, comes together is probably true. So what do you do? How do you deal with this? So you might be starting to forget things that once you did not. Be open if it seems to be a struggle. If you're still working during this time and your coworkers, you notice you're forgetting something and you notice your coworkers might be thinking about it, it's okay to just say it and really talk to your coworkers about it, or talk to your family members about it, because, it's a team effort again. How do you maximize your memory? Well, you have other people around for a reason, so really voice it and figure out ways and strategies to work together on this. And the chances are your families and friends will want to know, how you work best now, and you might not know. So try different strategies. So one way is taking notes. These are key. This is actually from Randalynn. She before, verbal direction was fine, but now she takes so many notes, and the visual component is really important to her. And for some people, before, maybe visual component, writing things down was what was needed. Now you might forget where you put the piece of paper, right? So luckily we have our phones and we can maybe put it on our phones, or maybe you need, someone to actually verbally tell you multiple times. That's okay too. So the idea is that, dates and times, it can be a little confusing now. So triple checking might be needed. And again, have those around you help you. And so, there might be just different strategies to try for memory, but to thrive during this time is to A, recognize it, and B, maybe let those who are really close to you or who you want to know this is an issue, and then just try different strategies. Taking notes has been really effective. Putting calendar invites, calendar reminders, using that phone that you have to really help maximize your memory. So what's next? Let's say you had to have treatment and you're now post-treatment and you're your initial year after diagnosis. So after chemotherapy, active surveillance with lab tests and possibly CT scans. And that's sort of the medical part of it, right? So that your medical team tell you, what is next for that. But for you, find your new balance. What is it that that will make you thrive? Is it a new hobby? Is it trying new foods? Maybe having new friends, maybe really focusing more on the survivorship groups in town or nationally. That is your new balance. Eating well. We went through some strategies of some foods that helped during treatment. You could probably do the same for after diagnosis. A lot of these foods are still really healthy for you during this time too. And maintaining a healthy weight, and find the exercise that works for you. So remember, exercise is not just about the body, but it's also the mind connection. It really can help with depression, anxiety, and really helping that balance. And so keep laughter in the mix. Find that funny friend or find that funny TV show that really does help with that as well. So laughter is really important through all this as well. So let's say you're doing all this, but you're still having some symptoms. You've had these symptoms since the surgery, and you're having some pain and you can't really shake it off. You've spoken to your, GYN oncologist about it, or, your medical care team. And one idea actually could be work with a palliative care for symptom management. Palliative care has been associated with hospice care. It's not the same. In fact, the palliative care medical providers have more training actually in symptom management. And our American Society of Clinical Oncology, so this is sort of one of the main national groups, actually recommends considering palliative care within 8 weeks of diagnosis. So for those who have, very strong symptoms of maybe pain or insomnia, or just something that, we as GYN oncologists are able to treat sort of as a baseline, but we need sort of, more and more creative therapies, or just another, trained professional, this is a good way to approach this. And so they really focus on improving quality of life for those with cancer. And the specialist works with the rest of the healthcare team. So usually your GYN oncologist or your medical team provider, if you ask, hey, I'm having these symptoms, it doesn't seem to get better. We've been working on this together for the last several months. Is there someone else I can reach out to, like a palliative care specialist? And if they're not sure, then feel free to reach out to other groups, because they're certainly trained professionals who are very passionate and really well trained to help manage symptoms. And what about emotional and mental support? So the medical team, you can ask them if there's services through the Cancer Center for counseling. There are the local groups. OCRA have support groups. And in fact, if you go to the OCRA website, you can click on Just Diagnosed, and you can see that they even have a first steps link, an ovarian cancer support community. So for those who have and gained strength from internally with yourself and your close family members, but sometimes you might want to try reaching out to others around you or nationally actually to help with this support. And so I really like this line that says OCRA is here for you. And I just wanted to conclude this talk by saying that I'm also here for you. So if you have any questions, feel free to reach out. And I wish everyone the best through all of this. Thank you.